I'm the Communications Manager for the AIDS Education and Training Center's National Center for HIV Care in Minority Communities, or as we like to call it, the AETC NCHCMC. And welcome to today's conference call, the sixth in a series of pre-application calls to take and answer questions from health centers interested in applying to become part of the HIV and primary care learning community. I would also like to now welcome you and thank you for your interest in our program, the AETC NCHCMC. And remind you again that the purpose of today's call is to answer questions from you. So please listen closely. If you have questions, utilize the technology in front of you to ask questions as they pop up, or save your questions till the Q&A period at the end of this call. We're going to begin this web conference with an overview of our agenda. As you can see here on your screen, we'll provide a quick overview of the AETC NCHCMC. We'll also dive into an overview of the HIV and primary care learning community. We'll cover the selection process for health centers to participate in this program and provide you an overview of the application itself. As always, at the end of this call, we'll leave time for questions and answers so that you can ask any questions specific to your health center. Now, about the AETC NCHCMC. This program is HRSA's HIV/AIDS Bureau's major effort to reach beyond its grantees, the Ryan White-funded community, and address the evolving needs and nature of HIV care and treatment within highly impacted communities of color. The AETC is funded through the Minority AIDS Initiative and the AIDS Education and Training Center program. We are specifically tasked with expanding the organizational capacity of federally qualified health centers and lookalikes to provide care and treatment to people living with HIV. This work supports the President's National HIV/AIDS Strategy by reducing HIV-related health disparities through the expansion of HIV care and treatment capacity at the community level, as well as by facilitating linkages. The AETC NCHCMC program provides a comprehensive organizational capacity building in addition to clinical training on HIV care and treatment for up to 30 health centers annually. Selected health centers will undergo an intensive practice redesign to develop, expand, or improve organization-wide systems, practice processes, and outcomes in order to help build sustainable HIV/AIDS programs. Our next presenter is Christine Stewart, Program Manager for the AETC NCHCMC. I'd like to introduce Christine.
Thank you, Victor, and good morning. I'd just like to start by going over the HIV and primary care learning community. It is the main component of the AETC NCHCMC that health centers would be involved with. And just by starting by telling you a little bit about what learning community is. It is an established model that brings together multiple stakeholders around a common purpose, and it provides training, capacity building, and coaching while also sharing knowledge across organizations. By facilitating shared knowledge across organizations, the learning community generates new ideas and innovations and improves measurement of common health status indicators, and ultimately, we hope it works to ensure the delivery of quality HIV care. The purpose of the HIV and primary care learning community is to increase access to comprehensive HIV primary care for racial and ethnic minority communities severely impacted by HIV by developing the organizational capacity of health centers not directly funded by the Ryan White program. This next diagram visually depicts the learning community curriculum. It's designed around the patient-centered medical home model and practice redesign. I'm not going to go into detail, but I just wanted to show that it's built to support the integration of HIV into primary care practices while also providing clinical support for the expansion of HIV care and treatment. If your health center is selected, then we'll present the curriculum in detail to you as a group. The capacity building package that we offer to each health center will include TA in a variety of areas that are mentioned here, including HIV clinical care within primary care, patient-centered medical home with HIV as a population of focus, care coordination and partnership development and practice and system redesign, as well as maximizing revenue for HIV services. The curriculum will be delivered through self-paced learning, tailored on-site technical assistance, and utilizing distance technologies. In addition to the standard curriculum, we'll offer health centers a few resources to supplement the capacity building, such as clinical mentors to support the clinical learning, performance improvement coaches to provide guidance during the transformation process, and twinning with Ryan White Part C clinics in your region to increase sustainability of clinical TA that's offered through the center and regional AIDS education and training centers. And also, to support health centers in the learning community over time, we've created the Virtual Learning Lab. This slide is a screen capture of the lab, which is a restricted access web portal to provide a safe space for staff of health centers to engage in shared learning. It includes discussion boards, live and archived webcasts, discussions facilitated by AETC, NCHCMC, clinical and program faculty, and a resource library. So now on to benefits. So expansion in access to healthcare services beginning in 2013 could mean an increase in patients for health centers, including those living with HIV. So participation in this program can help your organization be proactive and prepared to provide care and treatment to people living with HIV. Also, thoughtfully expand services in a sustainable manner, learn how to maximize revenue to cover costs for the addition of HIV services, and connect to state and local networks to help support your new HIV services. So we realize that these changes cannot be implemented successfully solely by transferring knowledge to the clinical staff. So we believe that for change to be successful, we must enact changes throughout the entire organization. As mentioned earlier, we do this through practice redesign based on a patient-centered medical home framework. The federal regulations will require community health centers to become recognized medical homes in the next few years. So this project aligns with transformation activities that your organization may currently be involved in or may soon engage in. So while HIV is the population of focus in this project, the assistance you gain is broadly applicable and supports the entire organization. All of this will be supported by access to expert faculty, many live and archived webinars, and face-to-face workshops, as well as targeted technical assistance. So even if your health center is not selected for participation in the learning community, Health HIV can connect you to other capacity building opportunities we're involved with to improve your HIV services. So please do reach out to me or any other of the staff members listed at the end of this presentation. In terms of health center responsibilities, we do expect that it will be a one-year time commitment. So, each organization should also commit to develop or expand their HIV services. We expect that the participation should be supported by and involve the CEOs in each organization. And the CEO's role is to remove barriers for staff implementing the change by allowing sometimes access learning resources or just having a willingness to restructure organizational systems. Each organization will also be asked to appoint 2 learning leaders, one that will lead the practice transformation, the other will coordinate the learning needs of the clinical staff involved in this project. These leaders should be senior staff that have the power to enact change within your organization. These learning leaders will be our main contact for the project. We'll also be asking participating health centers to complete an organizational assessment as well as individual clinical assessments for providers participating in the project, participate in a site visit, and have regular communication with AETC and NCHCMC staff. Lastly, we expect the change to be supported organization-wide and not solely through one department or unit, such as the HIV department. So now on to eligibility. In order to be eligible for participation in the HIV and primary care learning community, organizations have to be federally qualified health centers or health center lookalikes. They can't be directly funded by the Ryan White HIV/AIDS program but we have gotten questions in the past about whether or not subcontractors are eligible. So if you're not the direct grantee, I just want to stress that you are definitely eligible for this project. We also ask or require that organizations have a 4-year history of primary care. If you are maybe 3 years and 3¼ years away, please feel free to contact us and we can discuss your specific situation.
This is Victor Maldonado, and I'd like to chime in at this point and remind all health centers on the call, if you have questions about the eligibility, contact us. We're happy to work with you to try to understand your particular situation, see if you're still eligible, and even if you're not, try to connect you with some of the other programs that Health HIV offers. So if you have any concerns or questions, please reach out.
Thank you. And so we've also identified a couple of other characteristics that might demonstrate that your organization is prepared to succeed. So if you've had senior leadership in place for at least 3 years, or you actually have a demonstrated commitment by having HIV included in your strategic plan, or have the capacity to manage HIV patients and report outcomes through EHRs, your participation will be easier. But if you don't have any of those, that by no means means that you're not eligible. Please do feel free to apply. We still have a number of organizations that don't fit into those exact criteria that are still successful in the HIV and primary care learning community. So in terms of other selection criteria, we are looking for organizations that are located in or near a community whose residents are at risk for or living with HIV and are predominantly racial and ethnic minorities. Preference will be given to organizations that are located in a geographic area with a high burden of HIV disease with relatively low resources. And additionally, the HIV/AIDS Bureau, our funder, has requested that the AETC and NCHCMC give particular emphasis to recruiting health centers in CDC's 12 high-burden areas called the Expanded Comprehensive HIV Prevention Planning Cities. And those 12 cities are listed on this page, but I don't want to focus on these because if you're not located in one of these organizations, in one of these cities, you are still eligible. So we're interested in recruiting from the entire United States and U.S. territories. We're interested in health centers that reach vulnerable populations like migrant workers, the homeless, transgendered individuals, and youth as part of this project. I also want to point out that we do have the application available in Spanish on our website. And if you have additional questions about eligibility, please do visit our website, project website, www.nchcmc.org. And in terms of the application, every organization will have to complete an application. It's available in Word as a fill-in form, and it's also available online. You can complete it as a web-based application as well. If you do decide to complete it in Word, please request that it be returned in Word so that we can download the information. But fax is also acceptable if you're unable to email the completed application. We've tried to make the application simple to complete, but we'd like to share a few notes about filing the application. You'll need your 2010 UDS data for Section 1. Questions requiring a narrative response are limited to 75 words in the response field unless otherwise noted. And we are requesting a signed letter of support from your board chair and that if we don't receive that, then we don't consider your application complete, and we'll just contact you if we don't receive it right away. In terms of the review, each application will be reviewed by an external review panel representing both primary care and HIV expertise. The review panel will make recommendations on the selection of health centers, and the selected health centers will be notified by the beginning of the new year.
Thanks, Christine, for that overview of the program.
Okay.
I believe you have a few key dates that you wanted to run over to try to wrap up this application process.
Yes, I just wanted to let everybody know, again, that applications are due November 18th, and that health centers will be notified by the beginning of the year, January 1st. If you are selected, we will begin practice assessments on January 5th. That'll be a mix of some phone calls, some on-site, filling out documents, things of that nature. But we'll schedule those, so we'll reach out to schedule those beginning January 5th. We'll also be holding a face-to-face community meeting in Washington, D.C. in the spring, where we'll bring together each of the members of the learning community, so you'll all get the chance to meet each other. You'll be ending your commitment to this program in December 2012, but you will have continued support from the project through August 2013 when the project is over.
Thank you, Christine, for the overview and the key dates. At this time, we're going to unmute all phone lines for questions, but request that if you do not have a question or are not speaking, that you press *6 to mute your line so as to deaden any background noise. You may also raise your hand by clicking the Raise Hand button, or type your question into the chat box located on your screen. All lines are now unmuted. We remind everyone that this is an opportunity for you as a health center or a representative of a network of health centers to ask questions about the HIV and primary care learning community and its application process. We've set this time aside to answer any questions you might have specific to your health center or generalized to the program. So we know you're busy people, so we hope you take this opportunity to ask any questions you might have.
And this is a much smaller group than we've had in the past, so feel free to ask your questions over the phone or chat.
And we have a question coming in from Eve. Eve asks, you mentioned CEO's time commitment. What kind of time commitment should I expect my CEO to give? Christine?
Sure. Well, the CEOs will be expected to identify the learning leaders in their health centers that will be leading this change along with the CEOs. But we do request that the CEO participate in the community meeting that I just mentioned. Again, that's that face-to-face meeting in Washington, D.C., held in the spring. And then we'll periodically want to check in with the CEO to see how things are going by phone. But, I mean, in general, the expectation is that the CEO's time commitment will pretty much mirror any of the other time commitments that you've had in other past collaboratives like the asthma or diabetes collaborative.
Eve, I hope that answers your question.
Okay, good.
And while we wait for other people to propose their questions, I'd like to remind you all that the 7th and last conference call discussing the pre-application process for the HIV and primary care learning community will be held this afternoon at 3 p.m. Eastern. If you have a colleague who might be interested, has not been able to join us on previous calls, or has just recently heard about this opportunity, please let them know that we will be conducting that call at 3 p.m. Eastern Time, and registration information can be found on our website. And we have another question coming in. I'm from a Midwestern state without an E-CHIP city located in it. Is it worthwhile for health centers in my region to apply to this program? Christine?
Yes, it absolutely is still worthwhile for you to apply for this project. As I mentioned, even though we've been asked to focus our recruiting in those E-CHIP cities, we are still looking for organizations that represent all sorts of different geographical areas and have different populations. So we are looking for rural organizations, we're looking for organizations in the Midwest, we're looking for organizations all over, again, representing different populations. So we definitely encourage you to apply. And we do have a number of organizations, most of our organizations actually this year are outside of the ECHIP cities, so please don't think that that's a deterrent.
I think that this is a good opportunity to mention that the enhanced selection process is merely that. It is an enhanced selection process and is not an eliminator of anyone's eligibility for this program. And we have another question coming in from Jim. Jim asks, what costs will be incurred by health centers?
So, well, actually, there are no costs that your health center has to take on from participation in this program. The only costs that you'll have to incur are staff time, really. We cover any CEBA or capacity building assistance and training. We will travel you to any required meetings. So there are no costs that you'll have to incur.
Jim, I hope that answers your question. I'd like to take an opportunity to remind everyone that their phones are unmuted, and if you have a question and would like to ask it of us, please take this opportunity to ask your question before the group.
Any of two options, you can chat it or just or raise your hand and ask, and we'll call on you.
Well, chat questions seem to be the method of the day today, and we have one coming in from Carol. Carol asks, is any funding provided to health centers?
Hi, Carol. This is Christine. Health centers selected to participate will receive limited financial assistance, but that's actually in the form of having travel and training and mentoring, TA costs covered in the duration of this program, and additionally expert faculty, training opportunities, technical assistance, and other related support will be made available to improve billing systems and revenue capture. I hope that answers your question.
Oh, great. Thank you, Carol. I'm glad that was able to answer your question. And as we wait for any last questions, I'd like to take a moment and remind you all that there is a quick evaluation at the conclusion of this call. If you have a few moments at the end of this call, please answer our brief questionnaire. Let us know how we can improve our communications with you in the future regarding this program as well as other opportunities Health HIV will be offering to health centers. And not seeing any other questions, I would like to thank you all for participating on today's web conference. A recording of this call will be available on our web page shortly. While there, we invite you to refer to the FAQ portion of the site. That's the frequently asked questions portion of the site, located at the top of the home page. You'll see a button at the top of our home page that reads FAQ. We will be conducting the last in a series of conference calls this afternoon at 3 p.m. Eastern. Again, if you have colleagues who might be interested in learning more about this opportunity, please let them know. And they can register by visiting our website under the pre-application page. And as always, our staff is available to answer any questions you might have about the application or the program. On your screen, you'll see contact information for Christine Stewart and Brad Ward, our program managers on this project. Thank you all for taking the time out of your schedule, and have a good afternoon.